Good evening and thank you for joining us. Federal and provincial leaders have urged Canadians to avoid non-essential travel internationally and domestically to contain COVID-19. With the exception of Atlantic Canada and the Territories, most of Canada has not been subject to interprovincial travel restrictions. But this week, British Columbia's Premier raised the possibility. John Horgan is consulting with experts to determine if it's worth imposing limits on people coming from other provinces and if it's even legal. Julia Foy has our top story tonight.
The combination of deep powder and low COVID numbers is attracting visitors to North America's biggest ski resort from outside BC. BC's Premier is concerned about the threat of COVID spreading from travelers and is exploring the idea of shutting the door.
I want to put this either to rest so that British Columbians understand that we cannot do that and we're not going to do that, or there is a way to do it and we're going to work with other provinces to achieve it.
The Atlantic provinces were the first to develop a bubble to restrict outside visitors, but experts warn it's not a one-size-fits-all solution.
It's very different from Atlantic provinces. Sometimes it is almost impossible to truly patrol travelers coming through the mountains and through various parts of British Columbia.
In addition to geographical challenges, there are legal hurdles too.
Just by virtue of there being a pandemic and a public health crisis doesn't mean that we toss the Constitution out the window.
Zweibel contends that a government has to prove there's a problem first.
Is there good evidence that a lot of transmission is coming from interprovincial travel, and is there also good evidence that there's no less restrictive alternative that would work to deal with that?
The provinces of Quebec and Manitoba have brought in restrictions which require all interprovincial travelers to quarantine for 2 weeks.
Even domestically, try not to undertake non-essential travel is actually important, not just for the international context at the moment.
More draconian measures have been tried around the world. Australia locked down the state of Victoria for 111 days, while South Korea gained access to the public's private information to track their travel movement. Professor Mendes thinks there's a better way.
If, let's say, the ski slopes could be the cause of major super spreader, then think about specific messages attached to them, using the evidence of what devastation could be caused.
Julia Foy, Global News, Vancouver.
Much of Canada has tough COVID-19 restrictions, but Alberta has started to ease its measures. On Monday, outdoor gatherings will again be permitted and hair salons can once again take appointments. The provincial government says it's being cautious by reopening the economy slowly. But as Heather Yourex-West explains, Alberta's healthcare system is still under a lot of strain.
February 20th, 9 a.m.
For hairstylist Beth Lloyd, the past month has been stressful.
It's definitely been challenging. I'm lucky because my kids are older and they have been in school, but I know a lot of other stylists are just hustling, like doing skip the dishes, driving. A lot of people's businesses didn't even survive.
Starting Monday, Alberta stylists like Lloyd will be able to return to work. Just a week after opening schools to in-person learning, the province has decided to ease restrictions once again.
We can't entirely ease up on this goal, but we can make small adjustments to provide Albertans with some limited activities.
Those activities include appointment-based personal care services and outdoor gatherings of up to 10. Funerals can now include as many as 20 people as well. After peaking in early December, Alberta's daily infection numbers have come down.
We've had some very good numbers over the holidays, and I think many of us are surprised that we haven't seen a Christmas surge, which is, fantastic news.
But the province is still seeing nearly 1,000 new infections of COVID-19 each day, and hospitals are still under strain. It's why a committee of Edmonton doctors, chaired by Alberta's former chief medical health officer, is calling on the province to wait before opening the economy anymore.
You should wait 4 weeks and then not activate the next phase unless you're sure that the previous one worked. If Alberta doesn't build on the success that we've had, if we instead start to undermine that success, we'll be right back to where we were.
Particularly with the added risk of 2 highly transmissible variants of the virus, the road to a safe reopening has become more perilous than before. Heather Yourex-West, Global News, Calgary.